If you saw this blood gas for your patient in the ICU, what would your diagnosis be? So the first thing you notice is that the pH is less than 7.3, meaning that this patient is acidotic. Next, if you look at the CO2, that's in a normal range, so we don't think this is going to be a respiratory acidosis. And then once you see the bicarb being less than 22, then you know this is going to be a metabolic acidosis. The next thing you want to do once you realize somebody has a metabolic acidosis is understand whether or not they have an anion gap metabolic acidosis or a non-anion gap metabolic acidosis. And you basically need these three electrolytes to figure out if there's a gap. So when you take your sodium and you subtract your bicarb as well as your chloride from that, if that number is greater than 12, then you can say that this patient has an anion gap metabolic acidosis. If that number is less than 12, then it's a non-gap. Now, for anion gap metabolic acidosis, there's an acronym called MUDPILES that goes through a differential diagnosis that could be contributing to this acidosis. The M stands for methanol, which is a toxic alcohol substance that's usually found in pesticides or other fuel sources that patients may drink and come in with toxicity levels. U is for uremia, which patients can get when they're in renal failure. E is for diabetic ketoacidosis, which is a severe form of high blood sugars where patients develop ketones and then start to get acidotic from those ketones. You can also see this in alcoholics as well as starvation ketoacidosis. P stands for propylene glycol, which is another solution that's found in something like antifreeze that patients may drink and come in with toxic levels. I stands for a couple things. Isoniazid, which is a medication that patients may take for a variety of reasons, one of the more common ones being for tuberculosis. I also stands for iron overdoses. This could be from patients who are taking iron supplements and also get toxic levels of that. L, which is probably the most common thing we see in the surgical ICU or in the hospital, is going to be lactic acidosis. Common sources of this are going to be bowel ischemia, or really anytime you're having lack of perfusion to organs where they're not getting the amount of oxygen they need, the lactic acid is going to build up in those situations. Ethylene glycol is another alcohol solution that's found in solvents like antifreeze again, or even ballpoint pens or cosmetic products that patients could overdose on. And lastly, the S is for salicylates, which is an anti-inflammatory compound produced by plants, but more commonly it's found in aspirin. And when patients come in with aspirin overdoses, it's usually going to be from these salicylates that causes the metabolic acidosis. Now, if you have a normal anion gap, meaning that when you add up the sodium and then subtract the bicarb and the chloride from that, if that number is less than 10, then you have a non-anion gap metabolic acidosis. And the acronym for that has 7 diagnoses in it and is HARDAS. Now, the H stands for hyperalimentation, which is basically another way to say that you're providing more nutrients or more food that you need to give patients. Although in this instance, usually you're not providing food. It's likely in the form of something called TPN or total parental nutrition for patients who aren't able to absorb food through their gut. The A stands for Addison's disease or adrenal insufficiency. R stands for renal tubular acidosis, which is when your kidneys aren't working properly and they aren't able to filter out the acids that are in your body. D stands for diarrhea, where you're having lots of loose stools and losing a lot of bicarb through that loose stools. A stands for acetazolamide, which is a diuretic, which causes loss of bicarb. Same with spironolactone, that's another diuretic that's going to lead to metabolic acidosis. And lastly, the last S is from saline infusions or normal saline, where you end up with hyperchloremic metabolic acidosis from the high chloride load that you're giving patients by giving them the 0.9% sodium chloride infusions.